Risks of ginger for our health. Ginger is an age-old root known worldwide for its incredible therapeutic properties and health benefits. It has been a reliable home remedy for centuries, used to treat various health problems, from improving digestive issues to relieving nausea and acting as an anti-inflammatory. But did you know that there are certain situations in which ginger should be avoided? Although widely known and used for its benefits, it's important to understand that ginger is not suitable for everyone. There are specific health conditions in which the consumption of ginger can actually do more harm than good. That's exactly what we're going to talk about today. We'll explore 10 specific health conditions in which ginger should be avoided or consumed with caution. Being aware of these conditions will help you enjoy the benefits of ginger and protect your health and your family's health. The health condition in which ginger should be avoided. Number 1 is heart problems. The first condition in which ginger should be avoided, or used with caution, is when you have heart problems. While beneficial in many aspects, ginger can influence blood circulation and blood pressure. Its ability to stimulate blood flow and improve circulation, although generally an advantage, can be a concern for those with heart problems, as it can increase heart rate. This increase can worsen pre-existing heart conditions, leading to adverse effects. Additionally, ginger acts as a natural anticoagulant, meaning it can interfere with the blood's ability to clot. This can be a risk for people already on anticoagulant medications. The combination of ginger with these medications can cause excessive thinning of the blood, resulting in issues such as bleeding or bruising. Health condition number 2, type 2 diabetes. Another important point is the impact of ginger on people with type 2 diabetes. We know that ginger can lower blood sugar levels, which is positive for most people. However, for diabetics already managing their glucose levels, this can pose a risk. Sudden drops in blood sugar can cause dizziness, weakness, and even fainting, making it essential to be cautious and moderate in ginger consumption to avoid these complications. Additionally, the anticoagulant properties of ginger, while beneficial for many, can be problematic for diabetics with blood clotting issues. Excessive use of ginger can worsen these problems, increasing the risk of complications such as bleeding disorders or bruising. Moreover, some diabetics may experience digestive issues with ginger consumption, known for stimulating the digestive system. This can cause discomfort, bloating, or exacerbate existing gastrointestinal problems, which is concerning for diabetics since gastrointestinal disorders can directly affect blood sugar levels. Number 3, pre-operative phase. If you are undergoing surgery, it is essential to be mindful of the foods and supplements in your diet, as they can interact with anesthesia and other medications used during the procedure. Ginger specifically deserves special attention here. Its ability to increase the risk of bleeding is a significant concern in surgical procedures, as it can complicate the process and increase the chances of complications after the operation. As we have seen, ginger affects blood sugar levels, which is concerning for diabetic patients. Fluctuations in blood glucose caused by ginger can interfere with the regular administration of insulin and complicate blood sugar control during surgery. For these reasons, healthcare professionals generally recommend that patients avoid ginger, including supplements, teas, and as a food ingredient, for at least a week before any planned surgical procedure. Number 4, gastroesophageal reflux. Another important condition to consider when consuming ginger is gastroesophageal reflux, better known as GERD. While ginger is famous for its digestive properties, for people with GERD, it can have a different effect. GERD is characterized by the return of stomach contents to the esophagus, causing discomfort, burning, and even more severe issues. While many use ginger to soothe the stomach in cases of GERD, it can relax the lower esophageal sphincter, potentially worsening reflux symptoms such as heartburn and chest pain. Additionally, ginger can irritate the esophageal mucosa, exacerbating symptoms. In some people, it may be necessary to limit or avoid ginger to prevent worsening GERD symptoms. This precaution can help manage the condition better and maintain a quality of life, avoiding unnecessary irritations and discomforts. Number 5, consuming certain medications. A vital aspect to consider when consuming ginger is potential drug interactions, especially for people treating conditions such as blood clotting, hypertension, and diabetes. Ginger, with its natural blood thinning and blood pressure lowering properties, can interfere with the functioning of these medications. This can lead to unexpected effects and health problems, such as an increased risk of bleeding in people already using anticoagulants. In such cases, ginger consumption can intensify anticoagulant effects, raising the risk of bleeding. Similarly, For those controlling blood pressure or diabetes with medications, ginger can alter blood pressure and blood sugar levels, affecting the effectiveness of prescribed treatments and causing unpredictable variations. Number 6. Having kidney stones. Another point to consider when consuming ginger is related to people who have or are at risk of developing kidney stones. Ginger contains significant amounts of oxalates, natural compounds found in various foods. Under normal conditions, oxalates pose no major issue, but for those predisposed to kidney stones, especially calcium oxalate stones, it's a different story. Excessive consumption of oxalate-rich foods like ginger can contribute to the formation of these stones. Oxalates can bind to calcium in the urinary tract, forming crystals that can turn into kidney stones. Therefore, individuals with a history of kidney stones or at high risk of developing them should consider avoiding or moderating ginger intake. Number 7. Having gallstones. The presence of gallstones or stones in the gallbladder is a condition that also requires special care. Although ginger has many health benefits, it should be avoided by those with this condition. By stimulating bile production, ginger can cause discomfort or even exacerbate problems in people with gallstones. In some cases, excessive stimulation can lead to complications, such as blocking the bile duct, causing intense pain and other severe symptoms. Therefore, for those with gallstone problems, it's important to avoid or consume ginger with caution. Number 8. Bleeding disorders. If you have bleeding disorders, consider avoiding ginger. Despite being a popular spice and a natural remedy for various ailments, ginger has anticoagulant properties that can be concerning for those with excessive bleeding. The active compounds in ginger, such as gingerol, have antiplatelet and anticoagulant effects that can interfere with the natural blood coagulation process. This can result in prolonged bleeding and, in cases of bleeding disorders, potentially worsen this condition. Number 9. Low blood pressure. If you naturally have low blood pressure, be cautious with ginger. The active components of ginger, such as gingerol and zerumbone, are known for their vasodilating properties. They dilate blood vessels, which can cause a drop in blood pressure. For people who already have low blood pressure, ginger consumption can further lower blood pressure, which can be dangerous. Additionally, ginger can stimulate the production of hormones and neurotransmitters, such as serotonin and norepinephrine, which can also contribute to lowering blood pressure. This can be especially problematic for people who experience sudden drops in blood pressure, as it can lead to adverse effects such as blurred vision, weakness, tachycardia, a feeling of fainting, excessive sleep, and decreased energy. Number 10. Being underweight. A less discussed but important aspect is the impact of ginger on people who are underweight or struggling to maintain a healthy weight. Ginger is known for its role in improving digestion and reducing nausea, but its natural properties can be a challenge for those trying to gain weight. The ability of ginger to stimulate the digestive system and increase the production of digestive enzymes can speed up metabolism. This, in turn, can lead to lower nutrient absorption, making it difficult to maintain or gain weight. Additionally, ginger can suppress appetite, complicating adequate calorie intake for underweight individuals. Ginger is a wonderful spice filled with health benefits. But, as we've seen, there are specific situations in which its consumption should be avoided or done in moderation. If you identify with any of the health conditions mentioned in this video, it's crucial to seek advice from a doctor before including or maintaining ginger in your diet. This precaution ensures that you can enjoy the numerous benefits of ginger without compromising your health and well-being. And if you want to discover the incredible benefits of ginger for your health, click on this video appearing on your screen now. Click on it now and learn more valuable tips for better health and well-being. See you there.